Hello everyone, Dr. Alex Vasquez here to provide you some updates on vitamin D as well as to discuss and provide some context for a recent publication. You can see my copyright, trademark, disclosures, and scope information here. If at any time during this video presentation you want to read everything word for word, you're certainly welcome to do that, even though I'm not going to take the time to read everything word for word. My goal is to keep this quick and easy and to provide some contextualization for a recent publication. You can see the title of this publication here, Iatrogenic Induction of Vitamin D Deficiency, the Position Against This Potentially Harmful Practice, an Open Invitation for Its Proponents to Articulate Substantiation. I published this article in April of 2015, and I also posted it publicly with the invitation for some additional feedback, for example, and that invitation went out to 12,000 people. We had 400 downloads on the first day, so I feel like that provided an opportunity to have some authentic peer review in an open manner, very transparent, and to integrate that feedback into the article prior to its final publication on April 12th, 2015. The reason that I started to look at this information again is because I was about to publish this monograph on the microbiome and dysbiosis in clinical disease, and as I was going through this information on infectious disease and microbes, of course I had to discuss immunity and vitamin D, and I recalled a conversation that a group of us had last year in 2014 where we had a lot of controversy about this. So what I tried to do was take a brand new look at this controversy and this information and see what had developed, look at it with new eyes and see if the protocol had merit or not. And my opinion is very identical to what my opinion was last year, and that the protocol itself doesn't have merit. So here's an example of one message that I received in this regard where I was told vitamin D has an anti-inflammatory effect in the same way that prednisone has an anti-inflammatory effect. But suppressing inflammation when the body is trying to fight a stealth infection might not be a good idea, sort of like giving prednisone to a patient with TB. So that's a very clear articulation of what I consider to be profound confusion and misunderstanding of the value and function of vitamin D in the treatment of these autoimmune and microbe-related inflammatory diseases. So this was sent to me by a functional medicine practitioner who's also board certified in internal medicine. And we were in the process of having a discussion on this last year, which ultimately was not resolved. And hence I decided to revisit this conversation to see if we might make some progress in resolving it. Vitamin D is clearly not immunosuppressive like prednisone. The only thing that vitamin D and prednisone, in my opinion, have in common is that they're both taken orally. They both do have some anti-inflammatory effect, we might say, and of course they're both inexpensive. So my background on this, after having published several articles on vitamin D, starting here with 2004 monograph on vitamin D, The Clinical Importance of Vitamin D, a Paradigm Shift with Implications for All Healthcare Providers. This was published in Alternative Therapies in Health and Medicine. I followed that with an article published on the Lancet's website, thelancet.com, another article published in the British Medical Journal. I used a lot of that same information for a monograph published by the Institute for Functional Medicine, and also for a clinical trial that we published in Journal of Clinical Endocrinology and Metabolism also in 2008. I've continued to develop and mature that information, most recently in 2014 in a textbook of 700 pages called Functional Inflammology. Very interestingly, regardless of the passage of 11 years, I still hold dear many of the conclusions that we published originally in 2004, so I'll include some of those highlights in this brief presentation. My position on this is that vitamin D has many benefits against inflammatory, autoimmune, and infectious diseases with remarkable safety and affordability. Despite this mountain of research, some have claimed that doctors should induce vitamin D deficiency as, quote, treatment. I think that's very controversial. So I've substantiated my position, and I invite anyone else to substantiate their position, including the mechanisms of action, the microbes involved, the benefits, the risk-benefit and cost risk-benefit ratio, and other ethical considerations. Anytime we're going to withhold a beneficial treatment from patients, we have to justify that from many different perspectives: risk-benefit, cost-benefit, and ethically. So I invite people who espouse this position to articulate those arguments, especially when we have so much research in support of the use of vitamin D, especially in autoimmune and inflammatory diseases. And this is the only update that I've provided to this presentation, which again was originally composed back in 2012. Vitamin D supplementation on inflammatory and hemostatic markers and disease activity in patients with systemic lupus erythematosus. This is a randomized placebo-controlled trial published in Journal of Rheumatology 2013. 267 patients were followed for 12 months, given 2,000 international units of vitamin D per day. The findings included statistically and clinically important reductions in inflammatory mediators and disease activity, as you can see here. You'll notice that when we look at the inflammatory markers in this table, all of them went down with the exception of this one, C4, and that's the one that you actually want to see increase, because when this number goes up, that indicates that the patient is suffering from less immune complex mediated disease. If you look over here, you can see that the disease activity index went from 4.9 to 3, so we had a reduction in disease activity clinically, and we also saw a reduction in laboratory markers that are used not only for the diagnosis but also to monitor this condition. Anti-Smith and anti-double-stranded DNA levels decreased significantly in the vitamin D group compared to the placebo group at 12 months. So we saw very significant clinical improvements as well as multiple laboratory parameter improvements as well. Not surprisingly, therefore, the authors concluded, we recommend routine assessment of vitamin D levels and adequate supplementation of vitamin D in patients with SLE. So again, vitamin D provides numerous safe, inexpensive, highly important benefits for SLE patients. In my opinion, clinicians should use this therapy routinely unless specifically contraindicated in specific cases. And so what we're going to do now is take a look at some of the previous information I had gathered back in 2012, and we'll see what that data says in the context of everything that I've already just discussed. These slides are from my earlier teaching experience at a graduate level. Currently, all of my teaching is done through ichnfm.org. However, I might start participating in a doctorate level nutrition program in 2016 as an instructor for that program. So this is the first public presentation of this information, but again, it's not going to really be a formal presentation. I just want to review and contextualize a few things. So let's get to it. Immunological benefits of vitamin D. Vitamin D is immunosupportive, supports GI mucosal permeability integrity. It's anti-inflammatory in patients who are vitamin D deficient. So when patients become vitamin D deficient, they become hyperinflammatory, we might say, and their immune systems are dysregulated. For this reason, they have elevated markers showing excess inflammation, and when we give them vitamin D, we see a normalization of those inflammatory markers. In that manner, we could say that vitamin D has an anti-inflammatory effect, but it's not the same thing as to compare it, for example, to prednisone, which has a pharmacologic anti-inflammatory effect. What we're looking at here is more of a modulation or normalization of inflammatory pathways and processes. Vitamin D is also what we call tolerogenic. It supports immune tolerance, which is very good, especially when we're trying to treat or manage or prevent allergies, inflammatory disease, and autoimmunity. It has a very specific and profound anti-autoimmune effect, while at the same time helping prevent allergies, also having an anti-cancer effect. If vitamin D, as the other proponents state, if vitamin D had an immune suppressive effect, we would see an increase in cancer, not a decrease in cancer. Overall, I think vitamin D has unsurpassed cost effectiveness and safety, and consistent with that, we see reductions in all-cause mortality. Looking at this article back in 2002 from Journal of the American Medical Association, most patients don't get enough vitamins from the diet, and therefore they need to take a vitamin supplement, which should of course include vitamin D. If we look at this article from American Journal of Medicine 2003, when these patients were supplemented with vitamins and minerals, they had a reduction in inflammation as measured by the marker C-reactive protein by 14%. Again, as I already mentioned, we do see a reduction in all-cause mortality when patients consume vitamin D. According to this article, intake of ordinary doses of vitamin D supplements seems to be associated with decreases in total mortality rates. This is Archives of Internal Medicine 2007. I'll revisit that topic later in the presentation to show you a newer article. Let's look at this article. Vitamin D supplementation improves sustained virologic Vitamin D supplementation improves sustained virologic response in chronic hepatitis C treatment-naive patients. Let's look at some of the details here. The current study shows that adding a vitamin D supplement to pegylated interferon and ribavirin significantly increases the rapid, early, and late clearance of the virus in chronic hepatitis C patients. This study emphasizes the importance of vitamin D supplementation when added to standard treatment in all patients with chronic hepatitis C. Further studies are, of course, needed. They always say that. Vitamin D has an important role in the treatment of different bacterial and viral infections. The mechanism of action is unknown, and I'll show you some new information that actually helps us understand what those mechanisms are. But it may improve activities of immune cells that are important to the eradication of hepatitis C virus. Some of the ways that vitamin D helps to prevent or treat bacterial and viral infections is through the elaboration of these AMP or antimicrobial peptides. I've shown you the details here. The two main antimicrobial peptides in humans are cathelicidin LL37 and beta-defensin. Both cathelicidins and defensins disrupt the integrity of bacterial cell membrane, resulting in death of the microbe. So you could almost say, in fact you probably could say, antimicrobial peptides, AMP, are basically like the body's internal antibiotic. Let's look at more information on that. Here is an article on the vitamin D antimicrobial peptide pathway and its role in protection against infection. And the nice thing about this chart, as you can see here, is that what you see with vitamin D is an increase in the effectiveness of bacterial killing, yet at the same time you see reductions in inflammation and an increase in tolerance. So the immune system actually becomes more tolerant of the body's own tissue, so that you see a reduction in autoimmunity, becomes more tolerant of the environment, so you see a reduction in allergy, yet at the same time you see improved effectiveness of the immune system against bacterial and viral infections. I mentioned earlier that vitamin D also helps to tighten a leaky gut. Let's look at some diagrams to help us understand this even more. If we look at this article, the original work back in 2008, the vitamin D receptor positive animals had a very tight gut. The vitamin D receptor negative animals had a very leaky gut. So obviously that relates back again to inflammation, autoimmunity, and food allergies. At least 3 clinical trials have shown that vitamin D has an anti-inflammatory effect. And here is one of the studies that we're looking at right now from Quarterly Journal of Medicine 2002, a 23% reduction in C-reactive protein with modest vitamin D replacement. So these were vitamin D deficient patients who had excess inflammation. When they were given vitamin D, their inflammation went down. Yet the interesting thing about this is that the vitamin D dose in the study was so low that the patients were actually still vitamin D deficient at the end of the study. So certainly not a perfect study, but still some very impressive results. A 23% reduction in C-reactive protein. The next 2 slides provide a list of means by which vitamin D has a positive impact on the immune system. Again, I'm not going to read these word for word. You're certainly welcome to pause the video at any time and take a look. I'm just trying to provide some context here. But generally speaking, what we see with vitamin D in the immune system is enhanced effectiveness and reduced inflammation. So enhanced effectiveness against cancer cells, viruses, bacteria, other types of microbes. And yet at the same time, we see a reduction in excess inflammation, cardiovascular risk, all-cause mortality, and as I mentioned before, we also see a reduction in cancer incidence and cancer progression as well. Number 12, as you can see on this page, is that vitamin D blocks the development of Th17 cells, as I can show you on the following diagram. So here's a diagram from my book back in 2012, Functional Immunology and Nutritional Immunomodulation. This has recently been updated as Functional Inflammology, also a shorter version called Inflammation and Autoimmune Solutions. That was the second edition of this book that you're looking at listed here. So let's understand this a little bit better. What we start with in the TH world, as we might say, is what we call a TH0 cell. These are undifferentiated cells, and they have to make a decision, as we might anthropomorphize them, into either becoming a TH1, TH2, TH17, or a T regulatory cell. When we see autoimmune conditions and metabolic inflammation like type 2 diabetes, what we're mostly thinking of there is TH17 cells and a deficiency of these T regulatory cells. So what we want to do is regulate or normalize the activity of these inflammatory cells, TH1, TH2, TH17, and we do that by increasing production of these T regulatory cells. And vitamin D is one of the nutrients necessary for the preferred induction, we might say, of these T regulatory cells. So if we want to create more of these T regulatory cells from the TH0 cell, we need to supply sufficient probiotics, vitamin A, and of course vitamin D. So that's one of the ways that vitamin D helps us to regulate the immune system. It's not by directly impacting or impairing the function of the immune system, it's actually getting the immune system to regulate itself and to perform more effectively. And again, we do that with nutrients, including probiotics, vitamin A, vitamin D. Those help to shift these Th0 cells into T regulatory cells. Then the regulatory cells actually suppress or modulate, is a better word, modulate the activity of the Th1, Th2, and Th17 cells. And you see some proof of that right here on the following article. Vitamin D status is positively correlated with regulatory T cell function in patients with multiple sclerosis. So patients who have more vitamin D have more of these regulatory T cells, and therefore they have less inflammation and fewer clinical exacerbations of their inflammatory disease or autoimmunity, such as multiple sclerosis. Again, you see that concept supported here, and when we look at the human clinical trials, here's an example of using vitamin D to induce more of these T regulatory cells. This was a study done in healthy subjects, and you can see a similar study here done in patients with multiple sclerosis. Again, in both of these most recent two studies that I just showed you, what we saw is an increase generally in the number and effectiveness of these T regulatory cells within 1 month of supplementation with vitamin D. The animal studies have certainly substantiated everything that we've just discussed and everything that we are proposing here, and that is that vitamin D has a protective effect against autoimmune encephalomyelitis. That's the animal model version of multiple sclerosis. Collagen-induced arthritis is the animal model for rheumatoid arthritis, type 1 diabetes, inflammatory bowel disease, autoimmune thyroiditis, and animal models of lupus as well. And as I said before, vitamin D should really not be described as anti-inflammatory. It should be described as immune modulating and inflammation modulating. When people are vitamin D deficient, they are hyperinflammatory. And then when we give them vitamin D, that normalizes their inflammation and immune function. And what we see is a reduction in inflammation, but that's not really the same thing as saying vitamin D is anti-inflammatory. It just regulates the immune system. It doesn't have an anti-inflammatory effect like prednisone does, for example. Let's look at this article from 2007. Vitamin D inhibits the pro-inflammatory process by suppressing enhanced activity of immune cells that take part in the autoimmune reaction. So again, what you're seeing here represented in the literature is that vitamin D has a normalizing effect on the immune system. Again, here, vitamin D has become a significant factor in a number of physiological functions, especially as a biological inhibitor of inflammatory hyperactivity. Now notice, that's not the same thing as saying that it's anti-inflammatory. It inhibits excess inflammation. It doesn't suppress normal inflammation. One of my favorite articles of all time, published here in The Lancet 2001, a 78% reduction in type 1 autoimmune diabetes just by giving these patients vitamin D in the first year of life. This was a very remarkable study that administered 2,000 international units of vitamin D per day to infants, that is in the first year of life, and again the results showed a 78% reduction in autoimmune diabetes, otherwise known as type 1 diabetes. Here's the study. The study was started back in 1966 and they concluded in 1997. That's 31 years of follow-up and data collection. Very remarkable. Other information has shown that vitamin D could prevent psychosis, because what we see with these psychotic illnesses is inflammation of the brain, alteration in neurotransmitter pathways, etc. And since vitamin D normalizes inflammatory pathways, that's one of the ways that it helps to prevent mental illness, including psychosis and depression. Here's another human study supporting the use of vitamin D against autoimmunity, and here is an animal study as well showing the same. A nice review article here, vitamin D as an environmental factor affecting autoimmune disease prevalence. Another article showing that vitamin D functions as an immune modulator in autoimmunity in general and multiple sclerosis in particular. Nice article here. This is the one that I quoted previously, vitamin D and autoimmunity. Vitamin D is a biological inhibitor of inflammatory hyperactivity. That's not quite the same as saying vitamin D is anti-inflammatory in the same way that is prednisone, for example. As I mentioned before, vitamin D also helps protect against certain allergic diseases such as asthma and eczema. You'll see more information here. Here's an article showing some of the anti-cancer benefits of vitamin D. Again, in this study, the men received 2,000 international units. That's a relatively low dose. A more appropriate dose would have been 4,000 to 10,000 international units per day. That's the equivalent of about 10 to 15 minutes worth of sunbathing. What was shown here is that the men who received vitamin D had a slower rate of progression of their already established prostate cancer. So it slowed down tumor growth. Here's a nice article by William Grant and his colleagues showing that vitamin D could reduce the economic burden of disease and the premature death rate, at least in Canada. Of course, this would apply to other countries as well. Another article here showing that vitamin D has merit for cancer prevention. Now let's take a quick overview of vitamin D. When we dose this for adults, we're usually looking at least 2,000, preferably 4,000 international units per day. That costs about $20 per year. The only risks are very rare hypercalcemia. We have to look out for that, especially in patients who are taking a drug called hydrochlorothiazide, and also in patients who have granulomatous disease, such as lymphoma or sarcoidosis. Benefits include, as we all know, improved calcium homeostasis and bone health. Antidepressant effect has been shown in 5 studies. Alleviation of pain has been shown in many studies. Anti-seizure benefits, especially for children who are vitamin D deficient. And a lot of anti-seizure drugs actually cause vitamin D deficiency. So those kids definitely need to have their vitamin D status evaluated. What we might call an anti-inflammatory effect, improves balance and neuromuscular coordination according to several studies. It's also been shown to improve pancreatic insulin secretion and peripheral insulin reception. Reduces elevated blood pressure. I'll show you that in just a moment. Has also been shown to alleviate PCOS with a high degree of effectiveness. Promotes immunity to bacterial and viral infections. Promotes GI mucosal integrity, as I showed you from the article back in 2008. But again, here now in 2015, we've also seen another article published on the same topic. And again, promotes the induction of those T regulatory cells against autoimmunity, inflammation, and allergy. And once again, we have some anti-cancer benefits. The safety of vitamin D was conclusively established in this excellent review article by Reinhold Veith back in 1999, American Journal of Clinical Nutrition. I recommend this reading for anyone interested in this topic. As I mentioned before, total body sun exposure can easily produce 4,000 to 10,000 international units per day, suggesting that this is a physiologically appropriate amount. Let's look at what might be considered to be an excess of vitamin D. In this study, they gave patients a single oral dose of 300,000 international units of vitamin D. Most of us would consider that a very high dose, but only a few patients developed mild hypercalcemia, and no other major complications were noted. If you'd like to see some of my previous publications, you can download those from ichnfm.org/reprints. I will try to make those available to you. Again, here's my monograph from 2004, Alternative Therapies in Health and Medicine, thelancet.com, and the British Medical Journal. I also published a monograph for CME, again at that time through the Institute for Functional Medicine. I'll see if I can provide that excerpt for you. This page actually provides a graphic representation of what I consider to be the optimal range for serum 25-hydroxyvitamin D. Again, this last slide just reviews some of the clinical implementation tips and highlights. Toxicity of vitamin D is really mediated exclusively through hypercalcemia. So if you're concerned about vitamin D toxicity, the test that you do is to look for hypercalcemia. A lot of us routinely test serum 25-hydroxyvitamin D as a marker of vitamin D nutriture, we might say. A lot of us also look at 1,25-dihydroxyvitamin D, especially when we're working with new patients or patients who have inflammatory conditions. Again, you're welcome to pause the video and read everything word for word if you would like. So as we come to a close now, I'd like to at least touch again on the Marshall Protocol as it's well known. Many of the components of this protocol are actually very well established and very scientific. The concern comes when we talk about doing two things which have not received much substantiation in the research, one of which is the use of this drug olmesartan as a vitamin D receptor agonist, and the other concern that we have, I think, which is even more pronounced, is the intentional induction of vitamin D deficiency in these autoimmune, infected, and inflammatory patients with the purpose, theoretically, of liberating the vitamin D receptor from microbial metabolites that are interfering with the function of that receptor. I think that part of the protocol really has not been sufficiently proven, and I do stand by my original position on this, which is the induction of vitamin D deficiency is unsupported, and I think it's questionable both from medical legal standpoint as well as ethical standpoint. So for people who have different opinions, I have obviously now invited them to articulate their position and provide us a review of that in the journal. We'd be happy to publish a good review substantiating that other side of the conversation. Here's a nice clinical trial showing that adult men require 3,000 to 5,000 international units of vitamin D per day. This was a very important study, one of the first studies to actually look at what is the amount of this nutrient needed and utilized by the human body on a daily basis. You'd be surprised how we ended up with numbers like the US RDA at 400, 800 units was not based on any science whatsoever. This is one of the first trials to scientifically document the amount of vitamin D needed by adults, and the estimate is between 3,000 to 5,000 international units per day. So the human body does have an absolute requirement for vitamin D. It is an essential nutrient for life. Depriving patients of that essential nutrient for life would require a lot of justification. I have not seen that justification published, and again, now I'm inviting anyone to substantiate that other position. So here's a nice article of many showing that vitamin D helps to prevent and treat chronic musculoskeletal pain. The interesting thing about this is that within the last few years, we've seen several articles show that patients with chronic low back pain often have bacterial infections within their spine. Now, if vitamin D were immune suppressive, as some people have said, then what we would expect to see is a worsening of that condition when these patients are given vitamin D. However, we don't see that. We see these patients improve. So to say that vitamin D is immune suppressive, in my opinion, is just incompatible with the bulk of research that's published. Another article here, again, showing that vitamin D helps to alleviate pain. And finally, almost finally, that is, here's the article showing that vitamin D lowers blood pressure. Another article here showing that vitamin D reduces mortality, and I'll just read the conclusion here. Cholecalciferol vitamin D3 reduces mortality in adults more than placebo or no treatment. Other forms of vitamin D do not provide this benefit. Again, quick review of clinical benefits of vitamin D, as you can see listed here. My review published here and available online for free at International Journal of Human Nutrition and Functional Medicine.org. Just use the abbreviation as you can see here. Also ICHNFM.org. What I've done again is provide a rationale for the use of vitamin D. For people who want to articulate the rationale for depriving patients of vitamin D, I certainly invite them to articulate and substantiate that position. All of this will be further reviewed and contextualized in my upcoming monograph, Human Microbiome and Dysbiosis in Clinical Disease. That will be available in 2015. Until then, I invite you to take a look at our International Journal of Human Nutrition and Functional Medicine. We've had some very interesting publications there so far, and I'm sure we'll have more interesting publications in the future. Last year, we published this article, Assessment of the Diagnostic Accuracy of a Recently Introduced DNA Stool Screening Test. I think most of you would find this article very interesting. We also published a position paper led by Dr. Mark Houston on the HPS2 Thrive study regarding niacin. And we've also published a review article on the theory of metabolic correction, which was published in our journal as well as an independent publication that several of us co-authored here. We also published an antiviral immune strategy last year, both in English and in Spanish. And more recently, we've published an interview with a mitochondrial toxicologist, and I was also interviewed by the staff of CAM magazine, and we published that in the journal as well, specifically with regard to mitochondrial toxicology again. So all of these articles are available for you to download immediately, again, at the website ichnfm.org. In the near future, we've got some other articles, of course, coming up on statin drugs, glyphosate. We will also have commentary on the so-called omics revolution in functional medicine, which I originally published back in 2006 when I was editor of Naturopathy Digest. I think that if we're going to say omics could be the revolution in functional medicine, we might ask a few questions around that. One of which is, if omics is the answer, then what was the question? And who asked it, and for what motivations? If omics is the future or the revolution of functional medicine, then by reversal or omission, we would be saying that functional medicine has no future without omics. Proposing that omics is the future of functional medicine suggests that doctors are currently inefficacious, unable of making appropriate decisions without laboratory assistance. I think this makes both doctors and patients reliant on laboratory testing, which again is ripe for profiteering, as we have already seen with the DNA-based stool screening tests, which were later shown to be completely unreliable, even though patients and doctors spent millions of dollars on them. Another problem with omics being the future of functional medicine is that those laboratory tests will be chiefly available to the upper economic strata, thereby promoting rather than resolving health discrepancies. Of course, these tests will not have assured privacy, given that no one even has privacy right now. And I think that looking to the future and relying on omics distracts us from available actions that we could implement right now as a medical community and within the public. We're also planning to discuss vaccinations quite a bit, both the history and what will be titled What You Never Learned in Medical School About Vaccinations. So again, you're welcome to stay tuned, as we might say, and take a look at the website ichnfm.org. You can download these articles that I've already mentioned, as well as the upcoming articles that are already in the pipeline. I invite you to stay tuned to the website for upcoming publications as well as online continuing education opportunities.